We will get started because we've got a lot to get through this morning. So thank you for coming back quickly into the auditorium. I'd like you to make welcome Emily Moody, who's going to be talking about the anatomy and physiology of ACRRM's MCQs. Please make her welcome.
Hey, good morning, guys. Oh, magical. Happens without me pressing anything. So thanks for having me this morning. I'm one of the ACRRM medical educators, and I'm a GP anaesthetist from the Burdekin in Ayr in North Queensland. This presentation was actually prepared by Dr. Katie Goot. So she's the lead examiner for the ACRRM MCQs, and also, as you see there, a stamped scenario writer. She was unfortunately able to attend the conference to give this presentation herself, so I'm doing it on her behalf. If there's anything I can't answer, I will direct you to Katie. Okay. So this presentation is structured so that there's an overview of the standards used in the multiple choice questions assessment, including the anatomy of the MCQ exam, the content, context and statistics of the exam. Statistics, I know, come on, we can do it, guys, you know, push through. We'll then have a look at the structure of the questions and what makes a good multiple choice question, and we'll finish off with some exam preparation resources that are recommended for study and some exam tips. So this is really aimed at registrars and medical educators alike, so I hope you'll all get something out of it. Okay. So why do we use MCQ exams? Well, there's some really good aspects to the MCQ exam. Obviously, it's standardised. It's pretty simple to run. It's objective. You can ask questions about a really broad range of topics, and we can assess the candidate's ability in those areas. Obviously, it has some downsides. If you went through and guessed, you know, there's only 4 answers, so 25% of the time you're going to get the answer right. There's actually a huge amount of effort that goes in behind the scenes to create the exam. And we can't reuse a lot of the questions because they get memorised. It is hard to write a good question, which hopefully you'll appreciate by the end of the talk. It's easier to test recall but harder to test applied knowledge, and there's no way for the candidate to justify their answer or show their reasoning process like there is in the other assessment modalities. Okay. So we've talked about this a lot in the last few days, about what the ACRRM assessments are all trying to assess, and that is whether or not the candidate is operating at the level of an ACRRM fellow. Okay, so an ACRRM fellow, this is straight out of the textbook, and I think you guys have seen this slide a few times over the last few days. I am going to rush through a little bit because I've got a lot to get through in this time. So I want to talk to you about context. Those of you at the stamps talk yesterday, I'm sorry, you'll already be familiar with this vignette, but it's just a really great way to illustrate context. So this is a patient in whom there's a possibility of an ectopic pregnancy. What do you do next? Well, it depends, doesn't it? So what you do next in an urban setting as compared to a rural setting or a remote setting is really, really different. Context is king. In the urban setting, you'd go, she's got an ectopic pregnancy, I'll send her down to the hospital down the road. In a rural setting, you might admit her locally and manage as much as you can. In a remote setting, you're talking about when and how do we retrieve her. So completely different logistics. So context is king in the stamps and context is king in your multiple choice. This is another demonstration of context being king. So let you read that quickly before we keep going. Hey guys, welcome. You haven't missed too much. Sorry, we started a bit early. This is the multiple choice question presentation. Is that the right place? Okay. So this is a lady who needs palliative care, and again, how that case is managed is quite different depending on where it's managed. that's why a good MCQ question has a good stem, which helps put the question in context. Okay. Busting some myths about the multiple choice question exams. So, multiple choice exams aren't a reasonable way to test knowledge. Well, we'll go through some examples to demonstrate their usefulness, and we'll talk about the quality control and quality assurance that goes into the MCQ. I've scored well using XYZ online MCQ bank, so I should be fine for the ACRRM exam. Actually, the ACRRM exams have a specific blueprint and refer to the college curriculum. None of those online MCQ resources cover the ACRRM curriculum. So they might be good for, the technique of a multiple choice exam, but they don't take into account the context that we've just spoken of. So ACRRM resources are the best preparation for the exam. I've scored well on the MCQ practice paper, so I should be fine. Well, that's an open book with more time. I failed my last MCQ exam, but that's just because I haven't been lucky yet. Well, the pass rates on your second, third, fourth attempts historically aren't good. So you need to change something. Okay. So that's the context. So let's look at the content of the multiple choice questionnaire. So we've got our 18 areas of the curriculum, and you can see there approximately how many of the questions are going to be related to each aspect of the curriculum. And this is available from the ACRRRM website, the MCQ public report, and there's also, it's also in your fellowship assessment handbook, which I'm sure is really well thumbed. Okay, so you've got about 1 minute and 26 seconds per question. And it's the single best answer with no negative marking, and it's pitched at the level of a fellow. Right, so I'm going to step through some screenshots of the online ACRRRM primary curriculum document, which is available on the ACRRRM website. It's organised into 7 domains and 18 curriculum statements. So, there are a lot of MCQ preparation resources, especially online, that fail to address many of these 18 curriculum statements, including aged care, Aboriginal and Torres Strait Islander health, higher level obstetrics and women's health, palliative care and rehabilitation. So if you go onto the ACRRRM website and search for the primary curriculum, you'll come across the 7 domains. Using the example of adult internal medicine, the online curriculum document also has definitions of terms and essential knowledge and skills, which list specifics that exam writers use to generate multiple choice questions and stamp scenarios. This example lists the common or important medical adult internal medicine conditions a fellow needs to know. This next example is of antenatal care in the community setting. The expandable text can be clicked on to show specifically what a fellow is required to know and discuss when providing antenatal care. And this example is where the curriculum outlines the requirements for paediatrics emergency abilities, which specifies which procedures might reasonably be tested in fellowship assessments. Okay, so big hint is go online and be familiar with the ACRRRM curriculum. So we're going to talk briefly now about quality control that goes into the multiple choice question exams. So what we're trying to assess is we're trying to discover the truth that the candidate has achieved the standard of a fellow or not. An exam is a sample, and any sampling can lead to errors. So there's a gap between the candidate's performance and the truth, which is whether or not they've reached fellowship standard. You can get true passes, true fails, false passes and false fails. So when can you trust an exam's results? Well, we need to talk about reliability and validity in exams to help overcome these errors. Okay. So The validity is the ability of an exam to assess fellowship level clinical knowledge and ability, not medical student level, not subspecialist level, but fellowship level. The quality control around this for the ACRRM MCQs is that the question authors are themselves FACRMs, and the multiple choice questions are mapped against the curriculum using a blueprint with multiple reviewers involved. The reliability of an examination is the ability of the exam to produce stable, low random error results. And we know that the results of our previous MCQs are reliable because they're displayed on the public report. We use statistical measures known as Cronbach's alpha and the standard error of measurement. Okay, I don't think I'll go into heaps of detail on that in this forum because we're a bit short of time, but if anybody wants to ask me further questions about that, I'd be happy to answer them. Okay, so the NGOF method is used to set the pass mark for the exam, and this method uses content experts. So 5 to 10 experts review each multiple choice question and decide their score, and they decide what percentage of borderline candidates would answer the score correctly. The pass mark is the average of each of the expert scores for the whole exam. So an easier exam has a higher pass mark and a harder exam has a lower pass mark. Okay. This is for the visual learners amongst us, so you can help visualise validity and reliability. So the left upper target, or dartboard, I suppose, shows results that are not valid and not reliable. The right upper dartboard shows that the darts are on target, so they're valid. So the right upper shows that they're very reliable, but they're missing the mark. So they're valid. They're not valid, but they're very reliable. So this is like testing FACRMs using medical student content. So they'll reliably pass, but we're not testing what it is that we want to test. So we're not hitting the mark. The left lower dartboard shows all the darts are close to the mark, but they're scattered and they're not reliable, they're not repeatable, they're not consistent. So the danger is that the multiple choice exam isn't a good enough quality to determine if someone's hitting the mark or not. So in this case, we need to improve the reliability. The right lower is what we want. So we want results that are valid and reliable. So this is where we ensure that exams are constructed so that they are valid, so that they measure what they're supposed to, so that fellowship abilities are tested. This means that we make sure the exam isn't testing medical student knowledge or subspecialist knowledge, because that would be like that top right dartboard. The assessment team ensures that we achieve the bottom right, that the exams we run are reliable and valid. So just to prove that our exams are reliable and valid, we've got our public reports. So the Cronbach Alpha is asking, do different parts of a single multiple choice exam lead to similar conclusions about a candidate's ability? So it's questioning the internal consistency or reliability of the exam. The closer to 1, or the higher the results, the lower the error. So the ideal Cronbach alpha is more than 0.7, which obviously this 2017B MCQ exam had a Cronbach's alpha of more than 0.7, so it was a reliable result. The standard error of measurement is asking if a candidate did the test multiple times, how similar would their scores be? Or how close are we getting to the truth about whether or not they're operating at a FACRM level. You can calculate a 96% confidence interval for a candidate score. So a candidate score plus or minus 2 standard error of measurement, or 2 marks. Okay. So just going through a few of the previous exams and looking at the standard error of measurement and the Cronbach's alpha. These are all available from the ACRRM website under assessments, and I encourage medical educators and registrars to have a look at the public reports because you can gain so much information about the exam from them. Okay, so I think I've got maybe 15 minutes or so left, I hope. Someone will stop me so that Lynn can talk, but I want to take you through examples of multiple choice questions and how to write questions. So, this is the structure of a multiple choice question. So you've got a stem, a key, and then distractors in the answer. So this is the ideal question. The stem's clear, simply worded, unambiguous, realistic, concise, and presents a clearly defined problem. The key or the answer is correct and reflects best practice. It's the best answer among the options. It's not too obvious compared to the other options. So the distractors are the other options, the other three options in the answer. So a good distractor is plausible and attractive. Okay, so the best multiple choice question examines ACRRM content. It's the right level of difficulty, so not medical student level, not subspecialty. It passes the cover test, which means that if you cover the STEM, you shouldn't be able to still answer the question. The STEM should be relevant. It has attractive distractors. It's positively framed, so it's asking, instead of saying which one of these is not the right answer, it's which one of these is. And it's referenced with Australian guidelines. Okay, so we're avoiding questions like which of the following doesn't cause or which of the following is not a side effect. That's negative framing. So let's have a look at a few questions. Give you all a chance to read that. These are obviously not going to come up in any exams, not from the exam bank. Okay. Anybody want to have a stab? You'll need more coffee. More of those lovely bacon and egg muffins from this morning. Anybody want to have a go? What's the most appropriate additional therapy for Wayne out of those list of 4 options? Man, it's a tough crowd. I know a few of you. I'll start naming names. Okay, I'll be nice and I'll give you this one, but I'm not going to continue to be nice. All right. So, the distractors are in purple, so the incorrect answers, and the correct answer, the key's in green there. So it's saxagliptin, and the rationale for that is up on the screen. So he's an interstate truck driver, so he holds a commercial driver's license. So you can rule out a few of the distractors. Insulin and glycoside might lead to hypoglycemia, which you want to avoid. And his history of heart failure makes rosiglitazone less appropriate because it's a thiazolidinedione. Just rolls off the tongue, doesn't it? So this question's not bad, is it? I mean, it examines ACRRM content. It's probably the right level of difficulty. It passes the cover test because if you cover the STEM, you can't answer that actual question as a standalone question. The distractors are attractive. You have to think through and work out why they're not the best answer. It's positively framed and it's referenced with Australian guidelines. So that's a good question.
The difficulty there is that which reference do you use? The Australian Diabetes Society guidelines actually are an appropriate guideline, and they would say that any of those would be appropriate. It's my choice. So to be able to say to the candidate, well, you scored incorrectly on this one because the guideline that we've chosen is different to the guideline you've chosen. That's part of the difficulties.
That's tough. I mean, I guess it's the one which is the most appropriate, because you could argue that some of the others may be appropriate, but not as appropriate as saxagliptin. I don't write exam questions, and I'm not an examiner, but at the end of the talk, I've got a list of the guidelines that the examiners use to write the exam, so hopefully that'll be helpful to you.
If I could just turn that around another way, kind of make the stats can pick that up. So you look at the difficulty of it, having to get it right, either the best correlation for the best people get it right, the weak people get it wrong. And if that turns up an anomaly, you can analyse it. So if you saw an anomaly, because everyone else was using another set of guidelines, you might discard that question. On the other hand, if you saw that, 70% got it right, and the people who did well on the test got it right, the people who didn't do well on the test got it wrong, that would sort of validate it a bit more. So it's a really good point. You'll often get unexpected results.
Thanks, Conrad. Okay, so this is not a bad question. Let's try another one. Oh, I should give you the options, shouldn't I? All right, come on. I heard a C and I heard a B. What's that? Yeah, of course. Referral to the nearest available hospital for CT and neurosurgical review? Yes. This is an SAH until proven otherwise, really, isn't it? So, this question, does it examine FACRM content? Yep, it does. Is it the right level of difficulty? It's probably a little bit easier than the last question, I'd say. Maybe a little bit, not quite the right level of difficulty. Could be a little bit harder, I think. It does pass the cover test, doesn't it? Because if you cover the STEM, you can't answer that question as a standalone question. Are the distractors attractive? I think the 2 work certificate ones are pretty quick, easy to eliminate, aren't they? They're not really that attractive. It is positively framed, and it is referenced with Australian guidelines. So, 4 out of 6. Okay. A few more. You can already see a problem with this question, can't you? Okay, so what are the issues with this question? The STEM is too long, isn't it? It's way too wordy. Yep. Does it satisfy the cover test? Yeah, it does. Does it examine FACRM content? Yep. Is it the right level of difficulty? The distractors, I suppose they're not too bad. It's positively framed, but yeah, I've got some pretty big problems with that question. Okay, let's try another one. Oh, sorry, clicked too many times. So this question doesn't pass the cover test, because if you cover up that STEM about Joseph, you could just take that question on its own, which of the following statements about Q fever is true. This isn't really important fellowship knowledge. This is more of a medical trivia question. But it is an important fellowship topic, and it's nice and short. So again, not a great question. Okay. What problems do you have with this question? What's that? It is negatively framed, isn't it? Yep. What's that? There's no stem, that's right. So it's not nothing to do with context at all. I don't see how that, it doesn't satisfy the cover test. It's not really assessing important applied content. So the good points, it's unambiguous, it's definitely correct, it's got plausible distractors. Okay. So I hope that was useful to you in terms of understanding what makes a good MCQ question. It is valuable to write your own. Medical educators can help registrars write them in preparation for their exams. So the MCQ exam covers so much. How do you study for everything? Read the curriculum. The curriculum tells you what's going to be in the exam, and the blueprint tells you what's going to be in the exam from the curriculum. To pass the MCQ exam, you should be really good at working as an independent, safe generalist practitioner in a rural and remote area, because that's what the MCQ exam is trying to assess. Just as we said yesterday for the stamps exam, avoid pretending to study. Avoid doing things that feel like study but aren't actually effective. So this means don't study what you already know really well, and don't pretend to study by printing out notes and highlighting them without checking that you're actually holding on to new knowledge and learning it properly. SMART goals are simple, measurable, achievable, timely and realistic. You can cover the whole curriculum eventually when you set and then achieve the right goals. Katie likes to talk about how do you eat an elephant? And the answer is one mouthful at a time. You just take one mouthful at a time, chew, swallow and repeat. That's how you eat an elephant. The elephant of the curriculum can be eaten eventually when you set and achieve the right goals. And learn from your patients. Okay. So this slide's really valuable. So this is again from the lead MCQ examiner, telling you how to best prepare for your MCQ exam. On-the-job learning and identification of knowledge gaps is really useful, and often researching and learning for the purpose of helping an actual real-life patient makes things stick better than learning from guidelines and resources and textbooks. Reading everything ACRRRM has hosted on their website about exams is a good start, and there are lots of links and publications available to get to know ACRRRM exams better. Okay. So these are some of the MCQ exam strategies to try and help with your performance in the MCQ exam. So start preparing at least 3 to 6 months beforehand using the right resources as we've just discussed, referring to your curriculum and your blueprints. Practice alone and in study groups. Use the ACRRRM sample MCQs, which are available on the MCQ assessment page on the ACRRRM website, and sit the practice exam. Try and tame your nervousness, anxiety and panic so that your performance on the day is reflective of your practice as a practitioner and your best performance. So Katie had a few extra points here at the bottom about answering questions. Commit to a question and answer it to the best of your ability the first time you read it. Having half an attempt and then flagging the question for review at the end and having another half attempt when time is running out is a situation where two halves don't make a whole. There will always be some questions that annoy you or are difficult to understand, or where you can't see the purpose of the question, or where you're not sure what knowledge is being tested. But a difficult question isn't going to get magically easier at the end of the exam with additional time pressure. Commit to giving it your best shot and answering it once properly. If you have a block of text, when faced with a really long question or a block of text, read the first line, Then skip down to the end to find what question is asked to get your bearings, and then you'll have a focus about a strategy for hunting through the lengthy text to arrive at your answer. So you're reading it through a lens or through a frame. You understand why it is you're reading the STEM. Check if it's a question about diagnosis or management or contraindications or follow-up or referral or any other category of question. So if you're reading the STEM and it's about diagnosis, such as what's the most likely diagnosis or what's the most important diagnosis to consider, that's asking two different things. So you're reading the STEM looking for red flags, compatible and incompatible history, and clinical findings. Read the STEMs carefully, slowly, and properly. There's no use rushing through and reading it, skim reading it 3 times. You want to be really reading it and comprehending it for the first time. So pace yourself. You've got that 1 minute, 26 seconds per question. Okay. We're almost at the end. So on the day, you want to try and give your best performance. So making sure you have a good night's sleep the night before, making sure you've got your usual dose of caffeine in the morning, whatever that is, maybe a triple shot and maybe nothing. Have a go at all the questions because there's no negative marking. Use critical thinking, don't guess. You'll only be right 25% of the time if you guess. And avoid ruminating on difficult or annoying questions because there will definitely be some. Okay, there's another slide in here about the online MCQ banks. I think I've already alluded to the fact that they're not great as preparation for the ACRRRM MCQ exam. Katie says they're only 30 to 50% useful. So they're not examining the right context or the right content for our ACRRRM MCQ exams. Sometimes they're not even the right MCQ format. So they're useful as revision or to psychologically prepare for the exams rather than testing ACRRRM specific content and context. Okay. So Katie says that there's 796 questions in the Dr. MCQ bank. And she thinks that they're deficient in the emergency care and inpatient care domain, as well as the curriculum statements for higher level obstetrics, anaesthetics, aged care, Aboriginal Torres Strait Islander care, palliative care apart from analgesia, aged care and surgery. Okay. That's a few things. These are the guidelines that the examiners use when they're writing questions for the MCQ. So I'll just leave that up for a moment so you can take a photo and I'll flick up to the next one. I mean, a lot of these you guys should be using every day in your clinical practice. Lots of photos being taken. I'll just give you a moment and I'll flick through. So more guidelines. Okay. So we've sort of raced through there, but I hope that you understand a bit more about the context, content, statistics of the MCQ, as well as what makes a good question, the quality assurance that goes into the exam, and what guidelines are referred to when the examiners write the questions. Are there any questions for me? The first guideline slide? Yeah, sure. That's the one you want? Never too early. These are good guidelines, whether you're studying for the MCQ or not. Yeah, down the front there. I don't think so. Do you want to talk to me about that afterwards? You've got to.
I'm just curious in terms of thinking about applying it in an international audience, whether or not there are linguistic or cultural biases that could result in people from a non-Australian training background having different psychometric validities in the which might be lost because they're a very small part of your population.
We actually have a number of. Yeah. Do you want to talk to that, Karen? Yeah.
We have done a lot of this working?
Can you turn the mic on, please?
It's working? It's working. I have to sing. You might be sorry. We have done some work looking at the effect of different cultural ways of learning and also answering MCQs. There is a lot of information out there about that, but there's not a lot of nothing really that says that anybody approaches an MCQ in a significantly different way to an Australian trained candidate. So, yep, and we do a lot of data analysis on our own candidates, their backgrounds and their training pathway as well. So it's pretty interesting stuff that we don't really find a big difference. Did you want to talk to that, Tora?
Yeah, I could talk about this for ages. I think there's a couple of things. I think there's a very, very big topic of unconscious bias. Could we have unconscious bias in the way cases are written, cases constructed, that kind of stuff. So we're spending a lot of time looking at that. And that means, for example, analysing, and RT will tell you this with stamps cases and so on, where do the examiners come from? What are their backgrounds? What's their gender? And I can show you stats actually on age breakup and so on. So you want a diverse group of people involved in generating cases, because if they're all written by, I don't know, men who practice in Queensland between 40 and 50 years old, that's their world. So that's a really important thing. And I think there's a lot more to do there, and for example, there's a bunch of examiner training, a bunch of peer review. If one person writes all of the questions, all of the stamp scenarios, then that person's view of the world is what's being examined. So we have a lot of peer review and a lot of diversity built into that. I think there's a very important thing if English isn't your first language, which is longer stems take longer to process. And there's a real debate around this, isn't there? Because it's an English speaking country and we practice medicine in English, but we recognise that and the exams aren't speeded. In other words, we're not trying to see how many questions can you answer in an hour or 2 hours or 3 hours. In an air traffic controller exam, you might want a speeded test, see how many things can you do under pressure. But people don't generally have a time problem here. There's enough time built in to read the stems, given that we've looked at the literature on this, that people will say, well, it's taken me longer to read a stem and digest it and think about the words and so on, whereas you'd flick over it quite quickly, of course, Gillian. So there's a lot behind this, and I think there's more to do, but we look at that very closely. Thanks.
I grew up in a rural town. I've never heard the term jackaroo. Is that something that would be like common language used in the exams? Because I feel like I'm Australian, I was born here, I was born in a rural town, it was small, but we had a vineyard, we didn't have apparently cows. I just realised that they work with cows. I didn't know this, but I possibly could have assumed it from Q fever. But is that the sort of language and dialect, I guess, that is coming up in the exams?
So that's another, great question. Tora can probably answer this as well, but we actually had a cultural and linguistic diversity talk, and we also had an evaluation done of some of the questions that we use. And so we presented that report and what to look out for. And I can give a really good example. In my previous job, we were testing literacy, and one of the questions was a tradie has a ute and he drives blah, blah, blah. You can imagine where it goes on to, but of course an international person, in fact, I was working with a German guy, he said, well, what's a tradie? And so we do give that report to all of our question writers. We also ask them to continually validate whether the questions are appropriate and whether we're using any jargon or anything that's, an Australian cultural term, a slang term. We also look at the questions to make sure that they're not particularly pointing out a group unnecessarily. We don't say, and I won't give an example of it, but you can imagine what I'm talking about there. That we don't stereotype. Yeah, that it's one particular group might be a drunken or drug taking or anything like that, because you don't want to pick out that kind of thing. Did you want to speak further to that?
I think the point there is that I think the point is you wouldn't want the word jackaroo, say, to be the thing the case hinged on. Do you see what I mean? If they're a jackaroo presents, you know, if you've got to know they work with animals and so on, that's one thing. If they could have been a plumber or whatever. So we do look at, when we write the cases, as to extraneous information. Are we, you know, are we wasting time? That very long stem that that you had before.
I guess those questions are always going to come up in an exam that is trying to use context in the assessment. Okay. Well, I think I'll leave it there and let Lynn give her talk. As I said, if you've got any more burning questions.
Oh, question, sorry.
Oh,
Don't forget.
I'm sorry, there's lights in my eyes.
It was just a quick question regarding your guidelines. The photos aren't coming out fabulously, and unfortunately I'm more ED than primary care. Is there a link to the guidelines that is available to ACRRM students, or can a link be made to the guidelines?
Is there a link to the guidelines?
Yeah.
These guidelines are all freely available.
Oh, no, I know, but the actual guidelines that we refer to in terms of exams.
In your assessment handbook, there's a list of recommended guidelines. Yeah, and it's also available on the ACRRM website.
Thanks
Yes.
very much.
You're welcome. All right, thank you.